Well, I'm going to hand this over to Justin then and let him get started because I think he's got a lot to share.
Perfect.
Susan,
Yes, wait a second.
I want to make sure everybody had the opportunity to sign the card for Mickey. He's in the hospital. And Sharon and I are going to take the card to her when we leave here.
Yeah, Mickey's in the hospital, so prayers for her. And one more thing, Justin Aulds, and through his company, has kindly and generously donated our lunches today, too. So we want to thank him for that.
Of course. And then I do have these little handouts, so I'll have, if you don't mind passing those out. I try to do the number based on the lunches, so. Again, my name is Justin Aulds. I'm with, now it's called Trucordia, previously Kentucky Health Solutions. We have a corporate partner on the back end to allow us to have some more resources and stuff to help out. What Susan is passing out right now, I just did a little 2-pager for everybody for Medicare. It has the drug plan stages with the updated maximum deductible and updated maximum out of pocket. And then on the other side are just examples of enrollment periods. So when is the annual enrollment period? October 15th through December 7th, that's on that sheet, as well as some examples of special enrollment periods. And then if you have an Advantage plan, keep in mind you can also change your plan January 1st through March 31st. You get one opportunity to change during that period. So, what I primarily was going to kind of go over today is just kind of re-hit some of the basics of Medicare for anybody that may not yet be on it, or just a refresher for those that already are. And then we'll hit some of the updates that have already been released for Medicare, and then I'll just kind of open it up to general questions, so that way I can answer what you really kind of want to know. So again, with Kentucky Health Solutions / now Trucordia, we've been in the business since about 2010. Pete Alberti started the agency. I came on in 2018 as his first full-time agent, and then from there we've just kind of kept expanding, and now we're up to 6 different agents in the office, so we have a few different people that are able to help. We've got over 30 years experience between us, and our primary focus is the Medicare market. We also do help with some non-Medicare, so if you have friends or family that are under 65 or may not yet be eligible for Medicare, we do have plans we can assist with that as well. Let's see if I can get this to go. So again, just hitting some of the basics of Medicare as far as who is eligible. So if you are age 65 or older, and younger than 65 with a qualifying disability, or any stage with diagnosis of end-stage renal disease or ALS, you do have to be a U.S. citizen or legal resident that has been here at least 5 years, and those 5 years have to be prior to enrolling in the Medicare. Your Part A and Part B services, that's what we call original Medicare. Everybody pretty much needs that to get any sort of secondary plan. So your Part A is your hospital coverage, your Part B is your outpatient medical, and then private insurance companies are going to offer those secondary plans. So they're the ones that, especially this time of year that's coming up, you're going to start hearing and seeing a couple of ads with Joe Namath and a few other celebrities. I've heard they run them a couple of times. Haven't seen him this year yet? Well, no. He's coming.
He's not on the right channels I'm watching right now.
Fair enough. So all of those are offered by your private insurance companies, and so Medicare has some base guidelines that all of these plans have to follow, but they can vary a little bit from plan to plan as far as what they cover and all of that. So things that original Medicare A and B does not cover that these supplemental plans can are going to be like routine dental care, eye exams related to prescribing any sort of glasses, so your routine eye care, cosmetic surgeries, massage therapy, even a physical is not covered by original Medicare. They do that annual wellness visit. Hearing aids can be covered by some of the secondary plans, and then of course long-term care and concierge care are not going to be covered by Medicare. So the numbers for next year on the Part B have not yet been released. So just as a reminder, this year's Part B premium is $185. If you qualify for the Medicare Savings Program through the Medicaid office, that can be taken care of for you. It has a deductible of $257, and then generally you're paying that 20%. And so with that Part B, those numbers will be updated later this year, usually early November is when that gets released for the 2026 numbers. So we are expecting those to increase, of course, because what doesn't increase with insurance, unfortunately, but it's something we don't expect it to be anything too crazy, but I know some of the projections we're putting it closer to $200, so we'll see. From there, again, as far as the secondary options are concerned, you kind of have two routes that you can go with that. When you first turn 65 or you're first enrolling in Part B of Medicare, because if you were still working, you may have employer coverage, you can go with option 1 or option 2, which option 1 is your standalone supplement plan with a prescription drug plan, so you have two kind of separate policies for those coverages. Option 2 is a Medicare Advantage plan, or Part C. They're the ones, again, that are advertised with a lot of celebrities, but they're going to have co-pays for everything you do. So they may have lower monthly costs as far as premiums up front, but you will have co-pays and a doctor network to stay with it. And so with those plans, what we like to do is we'll sit down with you, run your medications, run your doctors, make sure everything's covered as best it can be, based on the information we have at that time, because of course we don't have a crystal ball to tell the future. So there are special versions of those Part C or Advantage plans that are called chronic special needs plans or dual special needs plans. So the dual special needs plans are for those that have Medicare and Medicaid. So if you have full Medicaid, you're usually eligible for these plans. If you have partial Medicaid, there are partial plans that can help. And those plans generally help with your prescription costs, they help with some of your medical costs and some of those extra benefits. The chronic special needs plans are based on having a chronic illness. So a lot of the ones in our area generally are going to be heart and diabetes related. There may be an end-stage renal disease plan where basically they help with some of the costs for those high-cost medications or other things for those specific conditions. But generally for those chronic plans, you do have to get that condition kind of marked off or verified with your doctor, usually within about 60 days of enrollment. So just keep in mind, if you ever have one of those conditions and go to enroll in one of those plans, you do have to get it verified. So let me skip through a couple of these. As a reminder, on the Advantage plans, there are a few different types of network. There are HMO plans, which basically mean you have to stay in the network, which a lot of the time you can get a lot of your major facilities here in the network with these plans. But if you're wanting nationwide coverage, like let's say you just want to pick up and go to Mayo Clinic, MD Anderson, something like that, you would have to have that facility in your plan's network. So there are plans that have nationwide HMO networks. There are also PPO plans, which basically they have preferred providers that are in the network where you pay the lowest cost, but they do allow you to go to places outside of the network as long as they still accept Medicare. So you may have to kind of take on the billing on yourself, because sometimes facilities will not bill out of network with one of these PPOs, but it does still allow you to go there at that higher cost. And then we did already hit some of the special needs plans. Most of those are HMOs. There are some PPO plans for that special needs. It just depends on the kind. But always keep in mind on those networks, they can change year over year. And something that we may see going into this next year on some of the HMOs is there are some plans that may require referrals on the HMOs, because some do, most do not, but there are some that do. So just keep in mind, you get that annual notice of change document year over year. That's where it's going to have all the changes for your specific plan. Let's see. So for any of the secondary Medicare plans, I don't know where I'm picking up feedback. You do have to keep your Part A and your Part B in place, so make sure you always have those set up and paid for. With the supplement plans, you also have to have both Part A and Part B. The Part D drug plans, you technically only have to have A or B to stay in a drug plan. So, because there are some that may not be eligible for one of the styles of plan, so just have to keep that in mind. So going into this next year here, there are some changes on the drug plans. So always keep in mind the formularies for drug plans can change year over year too. So that's the list of drugs that are covered, and they place those drugs in different tiers, and again, even tiers can change year over year. So that's where that annual notice of change document can come in. We can also help you with your review of your prescription drug plan or your Advantage plan to make sure it's still going to be good going into next year. And again, the plans can charge those tiers separately, and even the deductible can be charged by tier. So for this year, the maximum deductible was $590. That could be on tier 3 and higher only. It could start at tier 2 or it could start from tier 1 and above. So that may be some of the changes that we're seeing going into next year, is they could change how they charge that deductible on the tiers of your prescription drug plan. So again, keep that in mind as you look at these annual notice of change documents. And then for your enrollment periods, I'll just kind of run over that quickly again. Your annual enrollment period that's getting ready to come up is that October 15th through December 7th. This is when you can make changes to the Advantage and the prescription drug plans. Your Medicare supplements you can generally change any time of year because you usually have to answer the health questions to do so. So those are not tied to this period. But the Advantage and prescription drug plans, October 15th through December 7th. Any changes you make during that period will begin the first of the following year. For those that have the Advantage, again, Medicare Advantage open enrollment runs January 1st to March 31st. They basically brought this period back to give everybody one last chance to change their Advantage plan. Because sometimes there are changes in medications or providers between annual enrollment and the first of the year. And I've had to move some people after we already chose a new plan because they picked up a new medication. And we want to make sure that everything's covered as best we can. And those, any changes made during that period will start the first of the month after you apply. So if you make the change in January, the new plan would kick in February. There are some special enrollment periods, so if you ever gain or lose eligibility for Medicaid or have a change in the level of that help, you can change your plan. If there are certain weather-related events, you can sometimes have a special enrollment period if it caused you to lose another enrollment period. So let's say you have an Advantage plan and you were planning to change it between the January 1st and March 31st, but we had terrible storms or floods or something was happening and you were in an affected area, you may be able to change your plan partway through the year. And they usually give us guidelines on those dates. Then as far as other qualifying events, if you move, the drug plans and Advantage plans are state and even county specific sometimes. So moving from one county to another, you may have new options. Moving from state to state, you'll definitely have new options generally, and you do need to make a change at that. And you have a 60-day window from either when you move or when you notify the company you're moving, whatever's later. So hitting some of the dual eligible extra help stuff again. With the dual eligible, you do that through the Medicaid office. It's called the Medicare Savings Program, and they have income and resource limits for that. So from the top of my head, I believe it was around $14,000 and change is the resource limit, and that's for an individual or a married couple. The income limits will vary based on individual or married couple, and those again do change a little bit every single year. But what that Medicare Savings Program does for you is it can help pay the monthly premium for the Part B, that $185 for this year. It can also pay deductibles, co-pays, and co-insurances on the plan if you're fully eligible for it. So there are a few different levels, and depending on your level, there are different plans available potentially. The other portion of it is called Extra Help. That is done through the Social Security office, and that is help on the Part B prescription drug plans only. So the income and resource limits for that are a little higher than the Medicaid, and you may be able to qualify for some help on the prescriptions, which again can help pay for premiums, co-pays, co-insurances, and deductibles on those Part D drug plans. Now getting into what's kind of big moving into the next year. So outside of some of the small changes there, the Part D drug plan, so this is on that sheet we kind of handed out, on the 2026 prescription drug payment stages is that. So this year, the max deductible is $590. That'll be all the way on the left side of this sheet. The new maximum deductible will be $615. Now, again, that can be charged by tier, and you may not have to meet it for some of the generics, or some plans just may not have it. It depends. So once you've met that deductible, you move to paying your co-pays or a co-insurance, usually up to 25% of the cost of the medication, and that's what you get credit for, towards the maximum out-of-pocket on medications. So the maximum out-of-pocket going into 2026 will be $2,100. This year it was $2,000, so it was just an increase of $100. But basically all of your deductible, your co-pays for your medications will add up towards that $2,000 or $2,100. If you hit that, everything should drop to zero from that point on. And then the last column that's on there all the way to the right talks about the Medicare payment plan option, where basically, let's say you have a really expensive medication or a few expensive medications, and you would hit that $2,100 or $2,000 the first month of the year. Even if you don't, you can still use this program. This is just a good example. So what they would do is you call up the drug company that takes care of your prescriptions, and you ask them to be part of this program. And if you were to meet that $2,000 in the first month, rather than pay it all up front, the $2,000 at once, you can do this payment plan, which they will basically have you pay them a monthly payment of the $2,000 that's been spread out over the remaining months of the year, and you can pay it to them, and then everything at the pharmacy is zero. So that way you can spread out that cost sum if you were going to have really high costs in that first month. So speaking of the prescription drug plans, we do expect some added or rising deductibles on the prescription drug plans. You may see more of the Medicare Advantage plans with prescription deductibles as well. So again, that annual notice of change document will list whether or not yours is going to add that. If it already had it, it may have just changed a little bit on the number, but we are expecting to see some of that. There may also be some plan reductions in some areas, so plans pulling out of certain counties or the plan just going away completely. Again, they have to notify you about that, and again, we can help with any of those transitions or changes if that's happening to you. Some of the Part B plans are also where some of them may be going away. They will automatically crosswalk you into a new plan. So don't just necessarily assume that your plan is going to be around next year. They may take you within the same company and just move you to a plan that has a very similar formulary. So the drug list and what's covered is about the same, but the premiums on the plans that you pay per month could be completely different. The deductibles could be completely different. So there will be some reduction in that we'll see. So there will be some plans where you'll be automatically crosswalked to others. So again, keep an eye out on those premiums. We can always help with those drug reviews. Usually all we ask is you send us a copy of the list of your prescriptions as well as your preferred pharmacy, and then we can run that for you, let you know whether or not we need to make a change. The other portion that's going to affect quite a few folks is what we call a value-based benefit design. So right now, all the Advantage plans and stuff are using what's called a value-based design. So for instance, the dual eligibles are who this will probably affect some of the most, because the value-based design means if you're eligible for the plan because you have the Medicare Savings Program, you automatically get all the extra benefits that are included. So that could be those food cards, the gym membership, some utility cards, things like that. What they're moving to in the coming years is they've gotten stricter on that, and they're moving to what's called special supplemental benefits for the chronically ill. So there were some plans that already had this kind of embedded. Basically, to get that additional card, you had to qualify through certain chronic health conditions. With the dual eligible plans, they did not have this before. So now it's going to be more towards that special supplemental benefits. So some of the extras, so your dental, vision, hearing should pretty much be unaffected by this, but any food style cards, utility cards, those you generally will have to qualify and have your doctor verify that you have a chronic condition. So that's going to be a big shift in some of those extra benefits that are added on the plans. And that's primarily what we're going to see there. So that's most of the updates. There's not a crazy amount across the board. I just like to hit some of the basics again, just to get a refresher, as well as, again, hit the information we have now. So November is when we'll get the information on that Part B premium and deductible. So we would have that with you. If you're already a client with us, of course, feel free. You can always reach out to us and we can let you know what that is as soon as we have it. So for now, I'll just kind of open it up to any questions anybody has. So, yes, sir.
On the special coverage for chronic disease, is that based on Medicaid and Medicare extra help by your income?
No. So the supplemental benefits, the plans can add these benefits into the Medicare Advantage is usually where we'll find those. So the plans can add that. You just have to qualify for it. It doesn't worry about the income when it comes to that. So like one example for a 2025 plan is there's a plan that offers a food card, but only if you have a chronic condition. So for that plan, it's not a Medicaid plan, so you don't have to have Medicaid to have it, you just have to have the chronic condition to get that one benefit. All the other benefits are standardized. So that's how it's gonna work going into next year too, is you're gonna have to qualify even if you qualify for the Medicaid. Those plans aren't just gonna have it built in, you're gonna have to qualify with the health now.
So all those coverages for the chronic diseases would be under an Advantage plan?
Yes, yeah, so the supplements will still cover all the medical stuff when it comes to it, but the extra benefits are not included in supplements generally. Those are only the Advantage plans where you're getting those quote unquote value added benefits of like the food cards, gym membership, the vision, dental, hearing, things like that.
What about Plan C?
Yeah, that's the Medicare Advantage is Part C. So those are the same thing. And so the Advantage plans are the ones that are somewhat affected by the change.
Are changes already made that the government was talking about?
Yes, so some of the changes have already been made. Some will be rolling over the next few years. So like one of the things that they're gonna start trying to do next year is actually negotiate drug prices down for those on Medicare. So that's something that process is starting next year. Most of the changes, they're still finalizing, so October 1st is when all the information is publicly available that we can share as far as what the plans are. If you already have an agent or you're with us, we can talk about your current plan if you've received your annual notice of changes. So we can kind of talk about your current plan over the phone there, but if we're wanting to talk about what options will be available next year, we have to wait until October 1st. Because they want to make sure all that is finalized and set with Medicare. Yes, sir.
I got a couple of questions.
Okay.
One, if I call you all, do you sell your customers' names to other agencies?
No,
You
no,
don't.
not at all.
So it's all private?
Yeah, it's just in our system and there's encryption on our customer system as well.
And, let's see now, what was number two? Number two was about, are they gonna, reduce some of the prescriptions?
Yeah, so they are working on that. So the first step happened this year where they added that max out of pocket on the prescription drugs, because previously, now we have the cap of 2,000. Previously with the donut hole, the average was about $3,400 out of pocket. So they've reduced some of the costs down there. And then going into next year and 26 and beyond, they're gonna start talking to the manufacturers of these drugs to try to bring their costs down more. Because they're kind of price gouging.
Oh yeah, I know one drug's pretty pricey. So
Oh yeah, there's a few out there.
yeah, I know one of them. So
Yes, sir.
Could you clarify, you said the Part B was $185 for a
Yes.
supplemental to traditional Medicare?
Well, that's the Part B is part of original Medicare. So Part A and Part B is part of your original Medicare. That's everybody's base.
And that comes out of your Social Security?
And that comes out of the Social Security, the 185, and again, that'll be updated for 2026. And then the Medicare supplements and all of that you usually pay directly out of your bank account.
And the new deductible is $257 what?
Well, that 257 is this year's
And you
deductible.
don't
We don't
know
have the next year yet. So I was hoping we would maybe get it a little sooner this year, but of course not. the government doesn't like to do anything fast.
Do you expect, or have you gotten any notice of the supplementals that are existing in traditional, supplemental to traditional Medicare?
Yeah.
Does there appear to be a whole lot of variation of the plans that are offered from Fayette County?
No,
Everything's
so
kinda staying the same?
everything's pretty much staying the same as far as the supplements are concerned. So if you have like a Plan G or a Plan F, all of that coverage is staying the exact same going into the future years. What we have, yeah, except for price, that's what I was getting ready to hit on, is price, prices have gone up. And of course, we've actually, in the past couple of years, have seen a little bit higher premium increases than previous years.
It's been very costly.
Yeah, and a lot of that is, some folks have delayed things from COVID, like didn't go into the doctor, have these problems that are now worse, and so taking longer to treat. And so they're having higher actuary costs on these supplements. So.
The same 6 questions to change plans is the same.
Yeah, pretty much all of that's about the same. Some companies have been a little more strict recently because they're trying to control their pricing. They don't wanna have to kick stuff up. But yeah, it's staying pretty much the same across the board as far as those. I think Patsy, you had a question real quick and then I'll hop over.
I was just gonna ask you, what is the top cost for Medicare right now? Out of my social security check, how much are they taking out?
It should just be the 185 unless you have an IRMA adjustment.
What's an IRMA?
IRMA is an income-related monthly adjustment amount, and so this
Can
year.
it go up from 185?
It can go up from
It
185, yeah, so going into next year, it'll just go up, like the base level will go up, and so will all the IRMA increases. But the IRMA is based on, your household adjusted gross income from 2 years ago. So for 25, they're looking at your 2023 income,
That's not,
and the limit for individuals is 106,000, or less, you pay the 185. If you're above 106, you have an IRMA adjustment.
and how much is it,
For,
do you know?
it varies depending on what bracket you fall in from
What the
there.
IRS tells them.
Yeah, so they automatically adjust that, but I think it was around 500 and change was the kind of top end of that, but that's for those that make over 750,000. And then for a married couple, the income limit was 212,000 or less, you pay the 185. If it's above that, you have that IRMA adjustment.
And if you are a single person, do you know what the amount is?
106,000.
106?
Yeah, for the adjusted gross, again, from 2 years ago.
Okay.
So, and then, yeah, Bobby, I think.
Yes, I did not use a lot of any kind of medical stuff for years.
Yeah.
And I was in a group, I guess, that whatever you pick A, B, C, all these different plans and programs.
Yeah.
And then there are other people that have had heart problems and liver problems and need wheelchairs and,
Yeah.
but there's nothing adjusted for that for me using less services, is that right?
That's correct, yeah, so basically.
Sort of socialism, right?
Ish, to the extent as in they're trying to make it to where, certain individuals are not price gouged. So they basically, everybody, like for the Medicare supplements, that's usually where we're seeing that cost, change the most, is because those premiums are based on everybody in your age band, in your area. Because otherwise, if they could just target out and single out individuals, there would just be people that cannot get coverage, period.
And when you talked about pills, medication, the manufacturer, there's something about a middleman, a middle person that I'm hearing about, that's really where the price gouging comes.
Yeah, so the pharmacy benefit managers, that's usually, so there's a bunch of different companies that do that, but they basically help negotiate some of the pricing and they help do all the in-house work when it comes to processing claims and doing things like that. And so that's where some of that comes from. So we've seen stuff like Cost Plus drugs from Mark Cuban. That program, they basically just charge you a set percentage. They're like, here's what we get it from the manufacturer, we add 15% and charge you a fee for shipping. So for some generics that aren't covered great by Medicare, we'll sometimes use that for clients and give them an option to do that. Of course, there's other discount programs like GoodRx and things like that out there. But so there has been a push for more transparent pricing on the prescription. So I'm hoping with that, along with what they're supposed to do in this next year about negotiating these prescription drug rates, I'm hoping to see some of that come down. Because I had a client that came from the Philippines that was taking an Eliquis. Here it's $600 a month retail, there it was $60.
Yeah.
And that's like, you're lucky to get a copay like that. So yeah, it's a huge difference. Yes, did you have a question, Asia?
Well, like, I'm not eligible for Medicare,
Uh-huh.
I do have Medicaid,
Uh-huh.
but even though I have a chronic condition,
Yeah.
one concern was for me, like, just for myself and my aunt, she's no longer living, but I try to, like, I saw the commercial where you can get the dual enrollment.
Yeah.
But one thing, they had her to sign something, like, if she were to pass away, that they would take her house. And, yeah, like, they're
Shouldn't
like
have done that.
the Medicare, recovery, like, your house, like, since they do all this for you, they sell your property and go.
Yeah, it could be part of the Medicaid, I'm not sure, because I haven't heard that on the Medicare side of things. But with the Medicaid, they may have something along those lines, because I know, like, even if you just have Medicaid normally, not with Medicare, if you have like an annuity, you have to sign over some of that annuity to Medicaid or something.
Yeah,
I don't know all the rules around that, excuse me, because we don't work with Medicaid directly. But generally, I think that would just be a Medicaid thing, not a Medicare.
Yeah, well, I guess maybe because I found I had multiple sclerosis, like, I was in my early 20s.
Yeah.
And so I didn't have that much work, I guess, quarters
Yes.
towards Social Security and things
Yeah.
like that. And it's like, I don't know, in my situation, would I even qualify, even though I have a chronic condition?
Yeah.
Like, would I even qualify for this or anything?
For the Medicare, so it's possible generally for those under 65 to qualify for Medicare, you have to be on disability, and you have to be on disability for at least 24 months.
Right.
And once you've been on disability for 24 months, they usually automatically enroll you in Medicare. So if you've been on disability for more than 24 months and still don't have Medicare, you may want to call and check on that, because it may be something where if they thought you had employer coverage and you opted out of the Medicare, you can do that.
Yeah, I was in my early 20s, when I found out, so
Okay.
it's been 22 years, so.
Yeah. So
So,
definitely, as far as that, so you would just have to see, because like, again, if you're getting disability, you should have already been enrolled. If you're not getting disability, then you would have to apply for that.
yeah, I guess maybe it's just the payments, I mean, cause like
Yeah.
with Medicaid, I don't have anything, but.
Yeah.
But I guess maybe my concern is, I have a daughter.
Yeah.
If something happened to me, I wanna make sure my daughter gets my home, not
Yeah.
Medicaid.
So that's just something, again, you would have to check with Medicaid on that, because I have never seen any Medicare application have anything to do with that. So I think that's more Medicaid related, so you want to talk to the Medicaid office on that one. Yes, Charles?
Two things. One, I did receive my Medicare and my Medicaid book, and the other one on the disability. Since I was on disability, I could not get the prescription program until I hit retirement age, and mine was 67 when I could have rolled into it.
So with, you mean for your, cause standalone prescription drug plans, you just have to have Part A or Part B of Medicare.
Yeah, I did
So-
have Part A and Part B, but I just couldn't get my prescription until retirement age.
They should still allow you to do a standalone prescription drug plan. The only rule they had previously was for the Medicare supplement plans. If you were under 65, you were not, the states were not required to offer, the insurance companies were not required to offer supplements to those that were under 65, and they may have asked health questions. They have since changed that rule, but that's the only one that I would know of that would make you wait until you're 65 or Medicare age. So, but your Social Security benefits, that could be different, as far as they may have made you wait to get the Social Security benefits with the Part D coming out of it. So I'm not sure on
That was 3 years ago. So,
Okay.
yeah.
It's gotten fixed for you, that'll be good. All right, anything else?
Say like if you don't have denture on your plan, but you have supplement, now if you wanna have some dentures made, then the supplement kick in even though you don't have it on your
Yeah, so some of the like Advantage style plans will have that included. If you have a standalone like Medicare supplement, like one of the Gs, you can purchase dental plans. Even if you have an Advantage with dental included, you can still purchase a standalone dental plan. They just don't coordinate benefits, meaning you can't use one in conjunction with the other, but you can exhaust one and then use the other. So you can purchase additional dental if it's needed. Yep.
What, you have an idea what that will run?
The dental plans, it can vary quite a bit depending on what level of coverage you need, but generally they could probably range between like 20 and 50 bucks a month. If you want dentures, you're probably looking at the higher end.
Thank
Of course. Any other questions? Alrighty, well, if that's all, I'll turn it back over. Thank you for your time. Glad we were able to provide some lunches. Hopefully they were good. Good, excellent. Well, I'll hand it back over to Susan here again. Thank you all.
Okay. Great, yeah. Thanks to Justin and Trucordia, all right. Well, that's it. I think it was very informative, and glad you all could attend. And I think the rest is up to your rides, and whether you want to stick around and socialize a little more, you're welcome to do that. Or if you have any questions, grab Justin before he leaves. Anybody got any other questions for me?